Hey, everybody. I want to do one more episode about Sugar-Free MD After Dark because I didn't get to do any of the questions. And I've gotten so many good questions, so I wanted to take a minute to answer those. So we'll just see. It might be a short episode. I'm not sure. Um, Remember, it will likely not be a G-rated episode because we are talking about intimacy and adult sexual satisfaction. So if you've got kids, just remember that. I'm talking about medical stuff, but I am not giving you your medical advice. You need to talk to your doctor about your specific case. I just am trying to educate so that you have some of the terms and feel empowered to go and have those conversations with your doctor. So this is in no way medical advice, but I want you to feel like you have what you need to have a good deep conversation. If you're in Louisiana and I do have virtual visits, I'm happy to see you, and then we can have a doctor-patient relationship. But this is for education, and I want you to just have what you need so that you can feel great no matter what age you are. This is all stuff I did not know when I was 30 or 35 or 40, and I'm going to stop there because you don't need to know exactly that I'm old. But I wish I had known all of this a little bit earlier because I definitely had a lot of time feeling like there was something wrong with me. That because my desire was so different than when I was in my 20s and 30s, I thought something must be broken, right? And it was causing frustration in my marriage because it was making me feel bad about myself and unsexy and all the things. And so when I learned all this, I just felt like everyone else should know it too. It's kind of like everything I've done up until this point. When I learned about coaching, I felt like everyone needed to know it. And the more I learned, the more I want to teach you because I don't think anyone should ever have to feel bad about themselves for things that are normal that we just didn't know about. And that is 100% the case with this. So I have a bunch of questions. So I'm going to run through them, give some answers. If you have more questions after this, just send them in. I can always do another episode if we need to. It's the beauty and joy of having a podcast is I can do whatever I want. So if you've got questions you want me to answer and you think everyone should know the answer, please email them to Dr. Stacy at sugarfreemd.com. So, first question. Is it normal that I love my husband and just don't want sex anymore? Yes, of course. Super normal. That's what we've been talking about. Love and libido are not the same thing, right? There are lots of people in very loving relationships that do not have very much sex. And they've agreed that that is okay. And there are lots of ways to show that we love each other that have nothing to do with our libido. For a lot of women, desire becomes responsive, right? We don't have that spontaneous desire. We don't, see that hottie on the street and like our body physically changes and is like ready to have sex immediately. Although those days were fun, right? But that's just not it anymore. And that's okay. Totally normal. Okay. So if life is stressful or you're having pain with sex or you're exhausted, right? Desire and arousal, like there's multiple factors to that. And so we need to, number one, make sure we're comfortable, make sure we're not feeling pressured, try and like take care of some of these lifestyle things that we can, and just stop expecting it to be spontaneous. Okay. If it is, amazing. Okay. But it's not going to be like it was. And just understanding that it's totally normal for it to be very different. So very low or non existent is normal. Okay. So, spontaneous desire does not carry the relationship. We need to pivot and make plans accordingly. Okay, question 2. Why do I feel dry and irritated? Is that just aging? Down there, like my lady parts, is that aging? Yes, it's very common in perimenopause and menopause to start having some tissue changes, and that is estrogen shifting. So if you remember last week, estrogen is like a tissue hormone. Okay. So you do not have to suffer. If you are having vaginal dryness, vaginal tissue thinning, starting to have pain with sex, those are our GSM symptoms, and we can go to our doctor and we can ask for prescription medications for that. Okay. If we want to try an over-the-counter vaginal moisturizer first, get some lube, amazing as well. But Really, the permanent fix is one of these hormonal or non-hormonal medications, FDA approved for GSM symptoms to help sort of replump everything. Okay? So, why does it hurt sometimes when it never used to? Very common. Same thing, right? So it could be the skin quality. It could be a moisture issue. It can be pelvic floor tension, right? So this is something like, again, seeing your OBGYN and talking to her about this and having them do a pelvic exam could be very helpful, right? All of those muscles can change. And so sometimes we have to do something like pelvic floor PT, like maybe we're having spasms of some of the muscles or they're just over tense in our pelvic floor, and that can cause really painful sex. Okay, so we didn't even talk about that. We were just talking more about tissue and dryness. So, but there's this whole muscle component too, right? So we've got muscles down there that might need to be addressed. And so pelvic floor PT can really help with that. So if it is a muscle problem, if you're like, hey, I've already fixed all these other things and I'm still having like a lot of pain with sex, your gynecologist can do an exam and check and see, is it a muscle problem? And then they can address that with you. Okay. Pain will train your brain to not want sex. So if you are having pain, you owe it to yourself to explore all of this and to modify and fix what you can. And then if you're still having issues, make sure you're seeing a specialist to like really check out and make sure everything's okay. So comfort is the first step, and trying to identify like, is it a tissue quality issue? Is it a moisture issue? Or is it something else that I need to go have an exam and have someone check on sort of the muscular tone of what's happening there? Is it normal to never think about sex anymore until someone brings it up? Yep, it is. That's responsive desire. Okay. I'm almost wondering if that's part of the reason all the romantasy books are out now, right? Because it's trying to help all of us like think sexier thoughts or like be exposed to like sexier thoughts, hoping that it will increase our spontaneous desire. And I hope it does. That would be amazing. But it might help increase your responsive desire too. So don't poo-poo those books if you haven't read them. Like there's something for everyone, but they're very like there's a lot of sex talk. And so if hearing about sex makes you feel more in the mood for sex, like go get some sex books. All right, do it. But yes, it's totally normal never to think about it unless someone brings it up. That is responsive desire. That is the change we are seeing. We are not spontaneous anymore, and that is normal. Fine. Doesn't mean you're not going to enjoy sex when you have it, okay? Just means your brain is not offering that spontaneously to you. So planning and context and all of those like multifactorial things matter because your brain's just not going to offer that up. It's like, hey, we're bored. You know what we should do? Have sex. Like, no, that was our 20s. That was fun then. And we just have to make adjustments now. It's still fun. We just have to plan a little bit. Okay. Does testosterone work or is it hype? Yes. Both are true. Yes, testosterone can work. It has its place. But it's not magic and it doesn't help everything. Okay. It doesn't help 100 things. It helps hypoactive sexual desire disorder. So it's going to help you want it a little bit more. It can help with arousal a little bit more. So it can help it be maybe a little bit more pleasurable when you are intimate. And it can help with this immediate recall. It is not going to help with our lean muscle. It is not going to help with our fatigue or our stamina. Okay. There was one tiny study that showed a little bit of improvement in stamina, but it was at man level doses. So it was at super therapeutic. That's what we call it. Like super therapeutic doses. There was a tiny bit of help with stamina. And I don't remember the exact numbers, but it was something ridiculous. Like if you run 3 miles, you can run 10 seconds more. Okay. It was like minimal and it was at man doses. So, but it will help. Hypoactive sexual desire disorder. It has a clinical indication there. The studies have shown it will help with immediate recall. So a little bit of brain fog, but it will not help with those other things, unfortunately. Okay. Can I take hormones if I'm scared of cancer? It depends on your history and your risk. And that is something really that was stressed at that menopause meeting too, we call it shared decision making. So it's where you as a patient understand the risk and benefits. Me as the doctor or whoever your doctor is can explain all the risks and benefits. We can talk to your oncologist and then everyone like shares the decision, talks about for you specifically what the risk and benefits are and if it's worth it. Okay, so it's individualized medicine. It is not a one size fits all. Um, Local vaginal estrogen does not have the same safety and risk profile that systemic estrogen does. So it's not saying that like hormones are off the table, but it is something you need to discuss with your personal doctor and your oncologist. If you have had cancer, if it's just a cancer risk issue, you just need to speak with your doctor. Okay? Why am I so self-conscious about my body even though I'm fine? Because midlife just messes with your identity. The hormone shifts, I will tell you, we have this menopausal weight gain, and I feel like traditional medicine likes to say, no, you're not really gaining weight, or you're doing something different, or your appetite is up, or you've changed something. But there are studies that show it's a fat distribution problem. Okay, so it might not necessarily be like the scale is changing, but we know from the hormonal shifts that it is causing a redistribution of your fat. And so fat is going where it has not been before, and that can be really disorienting from a body image standpoint. So you're not imagining it, you're not crazy, you might be doing all the right things and all the same things. When we feel good, it is easier to be intimate. When we feel good about our bodies, it's easier to be intimate. Feeling sexy is a thought, right? It's a feeling. Sorry, it's a feeling. And we can generate our own thoughts about that. But hormone therapy could help, right? GLP-1s are great medications if you're overweight and you need them, right? So there are things we can do, but it's not, don't let people just say like, oh, you just have to deal with it. No, there's lots of things we can do, right? I coach menopausal women all the time on ways to lose weight, or ways to just change our mindset about it. But I disagree that like, there's nothing we can do, just get used to the extra 10 to 15 pounds. I disagree 100%. And hopefully whoever your treating physician is disagrees as well. So comfort, self-trust, self-esteem, it's all connected. But I do want you to remember that those feelings come from our thoughts. So if you're feeling like my body's disgusting or whatever, right, we need to do some thought work around that, maybe in addition to some medication. So that's what I'm going to say. All right. How do I get out of my head during sex? Slow down, right? When we start feeling pressure, like I'm taking too long or whatever it is, we got to be mindful and get out of our head. Slowing down can help, right? I think just understanding it's going to take longer than it used to take can be very helpful as well. So just understand like things are different. I need a bigger warm-up period. Like I need a longer runway before we fly. All right. So all you have to do is have a discussion with your partner. I need more time. Like that can fix 90% of it. If you can't relax, if you are in your head, like pleasure is very difficult. So we don't want to be a manager of the situation. We want to be mindful, like this feels like what feels good right now, right? But telling our partner, can we slow down a little bit so I can like have a little bit more time? Totally fair. Do it. Why does my husband or partner want it more than I do? Mismatch is so common, right? They're not having the hormonal changes we are at the same age. They're just not. So the mistake is making it mean that either you don't love me or you don't want me, right? So, and that's kind of on them a little bit, right? So if you're not wanting to have sex as much and they're making it mean that you don't want them, we just need to have a talk with them. It's like, no, like, that's not what that means. It means my desire is changing and we need to have like a pivot and we need to like have a conversation and we need like, I need you to understand I still love you and I want you, but like my spontaneous desire is gone. So how are we going to mitigate that? What's our plan? Like, let's plan together to make sure that we still feel connected and that you still feel like I love you and I still feel like you love me and I don't feel pressured, but we all feel good and satisfied and happy. Okay. So we got to take that pressure away. Planning connection can really, really help. And, every time we're cuddling can't turn into sex. That's it, right? Because then that's that pressure piece. That's where that comes in. Sorry if that didn't make sense. Is it normal to feel numb or is it that it's harder to have an orgasm now? Yes. Those tissue changes, blood flow issues, remember, like things are not immediately filling with blood. Like our areas are not getting ready the way they used to with spontaneous desire. So, and we could also have stress and tissue changes and pelvic floor tension. So there's lots of reasons that it can be harder or take longer. normalizing it usually can help, right? Because that can help us get out of our head. It's like, yeah, it's just going to take me a little bit longer. That's okay, right? And we can also decide with our partner, like if it really is a time constraint, like this really takes a long time now, and like I don't have that kind of time to dedicate, maybe like every time we don't have an orgasm, and that's okay. If we're okay with that, this, again, shared decision making with your partner. Like, hey, sometimes we're going to do it quick and like, don't worry about me. I'm good. Like, but I want us to feel connected and I want us to like be in a loving relationship, and it's important for me to feel connected, but it's not important for me to have an orgasm every time because I don't have that kind of time to dedicate however many times a week. Okay. So yes. Is it normal to fake it sometimes? Sure. But long term, like we're in our head if we're doing that and we want to be in the moment. So it's not my recommendation. I think it's better to be honest. Like, hey, I'm good for today. Like get back and like, we'll take more time, like, and I'll be ready for next time, right? Especially, I think if you have this desire mismatch where, like, you'd be happy with sex once a month and they want sex 3 times a week, like, maybe you don't have to have an orgasm 3 times a week. Like, maybe a couple of times you can be like, hey, don't worry about me, right? It's up to you. You shouldn't do anything you don't feel comfortable doing. There should be no pressure to have sex. It should be just a shared decision. But I also think it's okay to be honest and be like, hey, I'm like, I don't have time for me today, but I'm good with that. But only if you're really good with that. If you're not, don't say it. Okay. Don't offer stuff that's not true. Okay. What if I never want sex again? Well, you're probably not alone, but desire is a state, not a personality trait. Okay. So states fluctuate. So spontaneous desire might be gone, but our reactive desire might still be there. But thinking I'm just a person who never wants sex anymore is not probably accurate, and it's probably not helpful. Okay. So if you're just like, hey, my desire is different now, let's work around that, it's probably a much more useful thought to actually getting back to the intimacy that you do want, right? Does menopause change things, or why do I like? Yes, menopause changes things. The tissue changes, things don't feel the same. Yes, I think we've gone over that a little bit. Let's see. Is it normal to only want sex if I've had a drink? It's common, but it's also information. So it might mean a couple of things. It might mean you're in your head and alcohol is quieting your brain, and so that's why. Okay. So maybe, and what I find as women get older too, alcohol can really mess with your sleep, and then we can kind of get it in a vicious circle where it's like, I feel sleep deprived, so I'm not really in the mood, but I have a drink to get in the mood, and then we're kind of in a spiral that might not be where we want to be, might not be the healthiest. So if we realize that that's what's going on, and then we need to do the second sort of attention piece, like why is alcohol what puts me in the mood? Is it that my brain is too busy and it quiets my brain, or what else is going on? Okay. If it is quieting your brain, let's find some other ways to do that, right? So if normally I'm in my to-do list, but if I have a drink, I'm not in my to-do list, like let's just write our to-do list out, put it on the bedside table, and then like concentrate on what we're doing in the moment. Okay. Is it normal to want sex less after kids, even when they're older? Yes, of course. I think that's everything we've been talking about. But I want you to just remember, so important, planning intimacy is not unromantic. It's realistic, okay? And like, if we want that connection, planning for connection, I think just shows like how important it is to you and your partner. And hopefully that, even helps you feel more connected. Do I need lube every time now? Sure. Lots and lots of women do. Totally normal. Okay. And it's smart to use it. It's not embarrassing, because if you do need it and you don't use it and you have pain, what's your brain going to tell you? It's going to tell you not to do that again. And that's not that's not the point. So yes, it's totally normal to need lube every time, and you should absolutely do it because it is smart and protective and like all kinds of stuff. It's protecting your desire to use it. Okay. Last question. Why do I feel embarrassed talking about this? Because we're trained to, because good girls don't talk about sex, right? But embarrassment doesn't mean it's wrong. And it means you're doing something brave, I think. And I think that these conversations are important to have, especially if you want to have like a really connected relationship or a healthy sex life for as long as you possibly can. So, and you're not alone. Totally normal. All right, that ends my Q&A of this round of questions. If there's more, I would love to hear them. Anything, if there was a course and you were like, I want to learn this in the privacy of my own home and like hear all of what you said, but at a much deeper level, please reach out and tell me what would be the most helpful thing. So if there's something I didn't answer or something you're like, it would be so helpful if I knew the answer to this, or so helpful if you talked about this, please email me, Dr. Stacy at sugarfreemd.com, so I can make sure that ends up in the course, because I want everyone to have all the information they need. Again, because no one taught me, and I'm a doctor, right? So no one taught us in medical school. No one, the stigma about talking about it is out there. So it's hard to get the information if you want. And I want you to have every piece that you need to make your best decisions, to feel as connected as possible, to have the healthiest sex life you can. Because I want you to have the healthiest life you can. And I think part of feeling good about your intimacy and your relationship or your sex life just makes you feel good as a person. And that's what I want for you. I want you to feel the best you can feel for as long as you possibly can. And I want to try and make it simple so that you can do that as easily as possible. So hopefully this was helpful. I will talk to you guys next week. That wraps up our After Dark series. So if you didn't listen to the other 2 episodes, it's a 3-episode series. That's a lot for me, I think. So hopefully it was helpful. And I will talk to you next week. Bye.